the last few videos, we have discussed about general principles involved in the management of poisoning. So we have enlisted various general principles under poison management, which included stabilization, evaluation, decontamination, poison elimination, antidote administration, nursing and psychiatric care. Out of which we have discussed about stabilization in detail. So where assessment and management of various complications, which include airway and breathing, circulatory as well as central nervous system depression, was studied under stabilization. Let us see about the other principle in the general management of poisoning, that is the evaluation. Let us see this evaluation, in what condition it is very much appropriate. This is appropriate in person who got poisoned, where there appear to be no immediate crisis, so that we have sufficient time and detailed and thorough examination can be performed in those category of people. Suppose immediate crisis means with them we should not waste time by checking these aspects. These evaluation parameters, which includes detection of temperature like abnormal hypothermia or sometimes hyperthermia, or also many times the poison can cause acid-base disorders or convulsion, agitation, movement disorder, and even electrolyte balances. In the evaluation parameter, thorough examination of these parameters will be carried out. In under electrolyte disturbances, we will check for hyperkalemia, hypokalemia, hypernatremia, hyponatremia, or hypocalcemia. This is about the overall picture of evaluation. So these many tests in detail will be discussing. Let us start with the first, that is the hypothermia condition. So many a times some of the drugs what we are using, so themselves they can change the body temperature so that they may cause hypothermia. So here is a list of drugs which can cause reduce in the body temperature. Examples like alcohol, antidepressants, barbiturates, benzodiazepines, carbon monoxide, hypoglycemics, opiates, phenothiazines, and sedative hypnotics. They have property to cause hypothermia. Let us see about the hypothermia, its measurement. So always it is essential to use a low reading rectal thermometer for recording the body temperature. So we have electrical thermometers with flexible probes, even which can be used to record the esophageal as well as the bladder temperatures. So then once you are confirmed of hypothermia, it is better to start treatment immediately. Warming technique can be used. It is called as a rewarming technique. So for some mild cases, so a warm water bath can be used, which is having water of 115 degree Fahrenheit. So it is very much sufficient until to reach the core temperature to 92 degree Fahrenheit. So then even we can use some warm blankets also in order to speed up the reaction. So the rate of rewarming should not exceed 5 degree Fahrenheit per hour. This is the precaution you should take while using any of the technology. So then one more possibility other than the water, we can use heating the inspired air can be used. It is recommended by some as very effective in raising the core body temperature. Even some others, they advocate using gastric lavage with warm fluids, or even peritoneal lavage can be done with some warm dialase can be used, so that automatically they are going to raise the body temperature. In addition, it may be required to correct some other abnormalities which is associated along with this, like it may be hypotension, hypoventilation, even acidosis and hypokalemia should be checked out. This is how we can rewarm a person and we can bring back the changed body temperature. Rewarming technique we have discussed under this slide. Let us move on to other aspects like hyperthermia. Suppose oral temperature above 102 degree Fahrenheit, which is referred to as hyperthermia. If it is exceeded 106 degree Fahrenheit, very rarely this situation is observed of. So there may be an immediate chance of encephalopathy in such people. Even while confirming hyperthermia, it is essential to consider many of the reasons, which includes genetic susceptibility to hyperthermia, especially few people on exposure to certain drugs like skeletal muscle relaxants, inhalation anesthetics, local anesthetics, and even malignant hyperthermia condition, like there will be evaluation in the body temperature would be observed of. Such conditions should be distinguished from drug-induced or general hyperthermia. So many of the drugs as a side effects also they can cause hyperthermia. Say for example ADR of antipsychotic or neuroleptic drugs. Even without any genetic basis also there may be a chance of inducing hyperthermia in a person. Let us see a list of agents which can cause hyperthermia. So this hyperthermia can be observed physiologically either by muscle hyperactivity or by increased metabolic rate, or it may be impaired thermoregulation. Either of the three mechanisms these drugs causes hyperthermia. So here is a list of drugs which can cause hyperthermia by muscular hyperactivity. Examples: amphetamines, antidepressants, cocaine, MAO inhibitors, phencyclidine, strychnine, and many times withdrawal of alcohols or opiates itself it can cause hyperthermia in a person. So many agents like dinitrophenol, salicylates, and thyroid hormones, so they increases metabolic rate, so thereby there may causes hyperthermia in a person. So then some certain drugs like anticholinergics, antihistaminics, antipsychotics, ephedrine, and phenylpropylamine, phenothiazines, so they impair thermoregulation, so thereby they causes hyperthermia. These tables includes a list of drugs which causes hyperthermia. Let us see about the treatment. In hypothermia, rewarming was the procedure which was used here. So here for cooling, we can use some ice packs or water can be used. With the help of that, we can reduce the elevated body temperature. So initially, we should remove all the clothes and pack the neck and go in with ice. This is the first thing what we can do. So then, immersion in cold water bath, especially having 77 degree Fahrenheit, is very effective. But it is considered very dangerous in elderly people as well as the people who are suffering some heart complications. Then even we should take precaution such that the core temperature should not fall below 102 degree Fahrenheit. So then it's preferable to administer dantrolene in some cases, as dantrolene is a centrally acting skeletal muscle relaxant. Many of the hyperthermic conditions, so they have a direct influence by regulating the calcium channel, so thereby so it can also be used, because during this situation antipyretics drugs like paracetamol are ineffective, so that paracetamol should not be used in such situations. Let us move on to acid-base disorder. In one or two slides, I will be discussing in general about acid-base disorder. Before entering to actual acid-base disorder, let us try to understand the basic reaction which are involved in the buffering system. So you might be very much familiar with this reaction. Carbon dioxide plus water under the influence of carbonate anhydrase will be getting bicarbonic acid H2CO3. As it is unstable, so it may get converted into H plus ions as well as bicarbonate ion. This is a reversible reaction which you are very much familiar. Here H plus may represent the acid and the bicarbonate represents the alkali environment. This is how the major system in the body regulates pH. Let us try to understand some of the abnormalities which will be arised because of alteration in the normal physiology after exposing to certain medications. Even some disease conditions also they may precipitate such conditions. Let us try to understand. This is a general discussion, but it's better to know in detail about each terminology such that in the future whenever the term comes it will become very much easier for us to understand. Let us try to understand respiratory acidosis. As actually we are discussing about acid-base disorders. Among that the first is the respiratory acidosis and the next we will be talking about the respiratory alkalosis. And the other approach that is related with the metabolic, we have metabolic acidosis and metabolic alkalosis. Let us see about respiratory acidosis. Just you have to check about the pH here. The pH got decreased, means it's moving towards the acidic environment. So then other than this, as the name represents, it is a respiratory acidosis. So now we can check the partial pressure of carbon dioxide. The partial pressure of carbon dioxide is rising. As we know about the carbon dioxide nature, it is acidic in nature such that there may be a chance of decrease in the pH which can be observed. Simultaneously what you can observe means we can observe increase in bicarbonate ion, as the bicarbonate ion is an alkali substance. So now here bicarbonate ion level increases because compensatory mechanism in the body activates whenever pH get disturbed. Now pH have turned acidic, immediately the kidney can produce more and more bicarbonate ion. So now let us try to understand why this respiratory acidosis occurred, why the pH got decreased. The mechanism is alveolar hypoventilation. So many conditions like airway obstructions, say for example COPD or bronchial asthma or some lung diseases, pneumonia, pulmonary edema, and many of other conditions like respiratory muscle weakness, CNS depression, head trauma, drug toxicity, so and all. So they can cause hypoventilation. So once hypoventilation, the body got exposed, more and more carbon dioxide will be get retained. Once the carbon dioxide is retained, we know, so it can cause increase in the pH, means it will leads to the acidic pH, thereby increasing the bicarbonate ions can be observed. So this is called as respiratory acidosis. Now here we have got the information. Respiratory acidosis means pH drops, it will move towards the acidic, and partial pressure of carbon dioxide will be high. Compensatory mechanism, bicarbonate level will be high. Let us try to utilize this information to understand the respiratory alkalosis. As respiration, we should concentrate on the respiratory gases. So here we can observe partial pressure of carbon dioxide will be less, got reduced up, whereas pH got raised, means it's moving towards the alkali. So now, and the other way we can observe bicarbonate ion level also got dropped. So this situation is called as respiratory alkalosis. Why this bicarbonate level get decreases? Because here body compensatory mechanism works whenever body got exposed to alkalosis condition, immediately the reverse reaction of production of carbonic acid will happen by combining H plus ions and bicarbonate ion. H plus plus HCO3 minus will produce H2CO3, and it may get converted into carbon dioxide and water. This carbon dioxide will be get washed out from the body. Overall, it will lead to decrease in bicarbonate ion concentration. In order to match the situation, it produces more carbon dioxide from bicarbonate ion. So this mechanism is very simple. Like hyperventilation can be observed, alveolar hyperventilation. So thereby increasing the rate as well as the tidal volume can be observed. Whenever body got exposed with the hyperventilation, carbon dioxide may get washed out. It will lead to respiratory alkalosis. Many of the conditions, so it may causes alveolar hyperventilation like pain, anxiety, panic attacks, even pregnancy, hypoxemia, drug toxicity, especially salicylate toxicity. Or sometimes a person is under hyperventilation, mechanical ventilator, pulmonary diseases, in many situations. So it may causes respiratory alkalosis condition. So from this table what you can draw means what is respiratory acidosis and alkalosis. In respiratory acidosis we can observe partial pressure of carbon dioxide got raised. Then in respiratory alkalosis partial pressure of carbon dioxide got reduced. So now here compensatory respiratory acidosis, bicarbonate ion level get increased. Here respiratory alkalosis, bicarbonate ion got decreased. Let us move on to the other aspect of acid base disorder, that is the metabolic acidosis and metabolic alkalosis. In metabolic acidosis we can see decrease in the pH and partial pressure of carbon dioxide also got decreased. This is a composition mechanism. Further I will be talking about this composition mechanism. So now one more thing, metabolic acidosis, decrease in bicarbonate ion. So while talking about the respiratory induced acidosis and alkalosis, we should check about the partial pressure of carbon dioxide. When talking about metabolic acidosis and alkalosis, we should check about the bicarbonate ion concentration. So now here metabolic acidosis happened because bicarbonate ion is less than the normal. This situation is called as metabolic acidosis. So now what is the mechanism behind this? So it increases the production or sometimes ingestion of H plus ions also, or during this situation more and more bicarbonate ions should be get utilized, such that what will happen? Metabolic acidosis would be observed. So now here loss of bicarbonate ion can be observed in many situations. Like we can come across with high anion gap metabolic acidosis, lactic acidosis, severe tissue hypoxia, liver failure condition, or sometimes metformin use, ketoacidosis, starvation, diabetes mellitus, renal insufficiency, uremia, sometimes drugs, isoniazid, iron tablets. So many situations. So it may lead to metabolic acidosis. Fine. So this situation will produces more and more H plus ions. So thereby loss of bicarbonate ion can be observed. So then coming with the metabolic alkalosis. So here we can just check the bicarbonate ion. The bicarbonate ion is very much high. Coming with the partial pressure of carbon dioxide. Partial pressure of carbon dioxide also it is very high because happened due to compensatory mechanism. So now here pH is towards the alkaline. So now coming with the mechanism. So here severe loss of H plus ions have been observed because of many of the drugs or some disease conditions. Say for example it may be Cushing syndrome or hyperaldosteronism or sometimes chloride resistance or hypovolemia conditions or vomiting. So in such condition loss of H plus ions would be observed of. To compensate this, like more and more bicarbonate ion would be produced or it may be get ingested, so it may lead to metabolic alkalosis. So in this slide we have understood what is this respiratory acidosis, alkalosis and metabolic acidosis and alkalosis. Let us see about the compensatory mechanism. So now coming with this compensation mechanism represents physiological changes that occur in acid-base disorder in an attempt to maintain normal body pH. So this compensatory mechanism, sometimes it may happen very fastly, rapidly it may happen within minutes, and sometimes within a minute ventilation changes may happen, especially in metabolic disorder. And coming with some type like respiratory disorders, it is very much slow, sometimes several hours it will take, and changes may happen in the urinary pH. So already we had discussed about this metabolic acidosis, alkalosis, respiratory acidosis and respiratory alkalosis. Let us try to see about the compensatory process in order to understand why the partial pressure of carbon dioxide is decreasing. So now metabolic acidosis. So when there is a decrease in the atrial and cerebrospinal fluid pH, so with the decrease in bicarbonate ion which can be observed in metabolic acidosis, it will stimulate the medullary chemoreceptors. So thereby increasing the respiratory rate or tidal volume can be observed, which will lead to hyperventilation, so that more and more carbon dioxide will be get washed off. So the situation will lead to decrease in the partial pressure of carbon dioxide. Then coming with the metabolic alkalosis, where increase in atrial as well as cerebrospinal fluid pH can be observed with increase in the bicarbonate ion. This is the metabolic alkalosis, which will lead to decreased stimulation of the medullary chemoreceptors. So thereby decrease in the respiratory rate or tidal volume can be observed. Nothing but the hypoventilation can be seen. Because of hypoventilation, carbon dioxide retention can be seen. Thereby increasing the partial pressure of carbon dioxide can be noticed. This is how the compensatory mechanism will act. Coming with the respiratory acidosis, we have acute compensation as well as a chronic compensation. In acute compensation, much changes we may not observe, such that blood will try to retain back the pH. In chronic compensation, so now whenever respiratory acidosis, decreased atrial pH with increase in the partial pressure of carbon dioxide. This already we had discussed in the previous slide. So which increases bicarbonate ion. The mechanism, it may be with the kidney, where reabsorption of bicarbonate ion can happen with the proximal convoluting tubule, or also it can increase more and more H plus ion secretion in the form of H2PO4 or NH4 plus by distal convoluting tube and collecting ducts. So thereby we can observe retention of more and more bicarbonate ion. Then coming with the respiratory alkalosis, we have both acute as well as the chronic. In acute, buffer in the blood will regulate. When coming with the chronic compensation, so increase in the atrial pH with decrease in partial pressure of carbon dioxide can be observed. Thereby we can see decrease in bicarbonate ion. So this may happen because decreased absorption of bicarbonate ion by the proximal convoluting tubule can be observed. So thereby it will lead to a situation called as respiratory alkalosis condition. So this is about the general introduction of acid-base disorder. In the next slide, I will be talking about the management of such situations.